There's another condition that affects the prostate, and it's called benign prostatic hyperplasia, or BPH. Now, this isn't a cancer. What this is hyperplasia, well, hyper meaning above, right? And whenever you see that root word plasia, it refers to some sort of cellular growth or growth of a tissue. So the thing is that in men, the prostate gland gradually enlarges with age. It's a natural phenomenon. This is just something that happens with age. So the interesting thing, 90% of men, so most of the men watching this stream will develop prostate cancer, or not prostate cancer, BPH, once they reach 70 plus years old. So it's a natural consequence of aging and constant exposure to and production of these hormones. The interesting thing is that BPH also causes increased levels of prostate specific antigen. So the interesting thing about PSA is that they thought, okay, because we see increased levels of this peptide or polypeptide protein in the blood, therefore we're going to screen for this, and if you have high levels of this, you may have prostate cancer. Well, now they're finding that, or what they found is that this benign, again, benign means it's the opposite of malignant. It's not a cancer. It's nothing that's going to cause you to die or cause some sort of metastasis and cancer to spread throughout your body. So this is what a concept we call differential diagnosis. Like, you can have the same symptom or same marker or same sort of the same thing occurring, but how do you tell the difference between one disease and the other that share the same thing? So what happens here is that, so benign prostatic hyperplasia, what happens is that you have, again, here we have a urinary bladder and we have the membranous urethra and the prostatic urethra here. Well, remember that you have for the prostatic urethra, the urine has to actually go through the prostate first. So that urethra is going through the prostate. But what happens in BPH? Well, what if this prostate starts to swell and get bigger? Well, what happens is that, notice that it's starting to choke off that little prostatic urethra. Now, same thing with our blood vessels. If our blood vessels narrow, what happens to the resistance? The resistance increases. And if a blood vessel narrows, what happens to the flow through that blood vessel? The flow decreases. It gets hard to push fluid through a smaller tube. Same thing with the urethra. If that urethra narrows due to prostatic swelling due to BPH, then that's going to cause a difficulty with urination. This is why you might hear like older gentlemen talking about like, oh, or maybe this is why grandpa might take a long time when he uses the restroom. If he has BPH and a narrowing of his prostatic urethra, that's going to limit the flow. And this sometimes it gets like so occluded it's painful for these men, or it's very difficult. And that's not the only thing as well. Hey, what do we have running here? Well, we have the seminal vesicles and glands here. And what do? Well, they make semen, or part of semen, and you also have that ductus deferens or vas deferens that's carrying all the sperm from your testes and epididymis. So the thing is that you need the seminal vesicles and this ejaculatory duct to actually empty out when you have ejaculation in the male, right? But what's over here surrounding that ejaculatory duct? You have the prostate. So if you have BPH, what's that going to do? That's going to also limit the ejaculation of semen from this ejaculatory duct. So this is why it's not just urinary difficulty. It's also can result in painful so it can also result in painful or sometimes occluded ejaculations as well. So this is why it can be definitely uncomfortable for these men who experience it. So poor grandpa over there. So how do you tell the difference? So that differential diagnosis, you can't just go based on prostate specific antigen alone, because we see this in both prostate cancer and BPH. So one classic way you can tell is a typical check. And remember, so again, this is just a swollen prostate due to BPH, and this is a tumor. Now, if you remember the lectures when we talked about endometrial cancer and uterine cancer and cervical cancer, that cancer cells, they tend to be tightly packed and together, so tumors tend to feel denser than the surrounding tissues. Same with prostate cancer. The whole overall resilience and feel of it is different. So this is why there's the prostate exam. Now, where's the most direct way to actually get this? Well, thing is that one easy way to go there is from this entrance. So this is why prostate exam, what often happens is that or whichever physician is doing the exam, they'll insert the finger into the rectum and the prostate is right there. So what they can do is palpate it, and it's not that big, even though it looks big in this picture. It's maybe 1-2 inches, and it's not even really quick. They don't need to like keep it there for a long time, and they can just say, okay, is there any sort of like abnormal mass or lump? And that's one way to tell between. And they can also use what they call a biopsy, take a tissue sample as well. But if they feel and everything's normal, PSA is normal, they probably don't have prostate cancer. But yeah, that one is, even though it might feel personally invasive, it's better than having surgery or actually having to take an actual tissue sample from the prostate. But they might do that in case they do suspect prostate cancer. And the thing about prostate cancer, it also has big genetic components. And in the United States, there's an increased rate of prostate cancer in black men. And they are 50% more likely than the average American man to develop prostate cancer. And they're also 2 times as more likely to die from prostate cancer. And there's multiple things that can play a factor in it, like access to healthcare, whether they're actually getting these prostate exams or whether these prostate exams are being offered. But the thing is that when you're more likely to die from prostate cancer, sometimes one of the big factors is like catching it when it's too late. So that's why if prostate cancer runs in your family, you might want to get screened or let your primary care physician know about that. The interesting thing, something more local, is like men of Polynesian ancestry, so including Native Hawaiian, Samoan, Tongan, they're more likely to be diagnosed with late-stage prostate cancer. And again, the later you catch it, the more difficult it is to control it and the deadlier it becomes. So this is why if you're falling to these demographics, maybe you want to, if you have a good physician, they should know these demographics. But especially if you have a family history of this, you might want to be screened earlier.